Welcome, everyone. In the current era of precision-based medicine, ultrasound is emerging as a mandatory tool to diagnose critical conditions. After years of using abdominal point-of-care ultrasound, we realized that X-rays are very limited and sometimes misleading in diagnosing abdominal emergencies. This online training course will teach you everything you need to know about ultrasound assessment and gut injury, necrotizing enterocolitis, and surgical emergencies like malrotation, intestinal obstruction, and pyloric stenosis, as well as the diagnosis of fluid collections and many other abdominal conditions. In this course, we start with the pathogenesis of abdominal diseases and an explanation of the sonographic changes related to these diseases. The following is a sample of the course. I hope that you will enjoy. Let us start with liver diseases diagnosed by point of care ultrasound as a mass, tumor, cyst, and hematoma. Look at this image here, and you may, for the first moment, misinterpret this liver image as portal venous gas because you can see some white dots inside the liver. But when you give a good look, you can realize there's hypoechoic huge mass inside the liver. This hypoechoic mass is hemangioma. And these white dots are tiny small calcifications inside the tumor. They are not portal venous gas because portal venous gas is dynamic and should move. You can see also in this image the position of the probe. So the red dot is the index mark. You have the longitudinal image of the liver almost at the mid-clavicular line to get a good view for the bulk of the right lobe of the liver. But you need to apply also the transverse image of the liver for both right lobe and left lobe. In this view, I think you can realize easily there is a collection of fluid with thick wall inside the liver. This infant had high CRP and negative blood culture. This premature infant had umbilical venous vein during the first few days of life with extravasation of the TPN, and this TPN converted later into this abscess. So there's liver abscess making the cystic changes inside the liver. Again, the proposition, as you can see in the image, is similar to the previous slide. In this image, you can see hypoechoic or black collection between the capsule and the liver parenchyma. So this subcapsular hematoma, which could be due to trauma or due to hemorrhagic disease. Notice the proposition is more lateral, so you can detect this collection just between the liver and the lung, and you can see the diaphragm and also the capsule of the liver in the middle. So you need to put the probe more lateral, slightly posterior to be able to detect the collection of this blood almost at the costophrenic angle. The second disease related to liver vasculature is the portal venous gas. So on the left side here, you can see huge amount of air in the liver as massive portal venous gas, and this also can be detected by X-ray. But when you have mild portal venous gas, much less amount of air in the liver, this cannot be seen by X-ray. Ultrasound can detect even minimal amount of air in the liver. Portal venous gas is usually seen during the first 1 or 2 days of gut injury or neck and disappear after that. So it is easier to detect portal venous gas during early stages of neck. You may have also adrenal hemorrhage. You have hypoechoic collection here between the kidney, liver, and the diaphragm. When you have this collection, circumscribed collection of blood, this is adrenal hemorrhage. It can be also seen here. You have the kidney, liver, and the diaphragm, and this angle here, you have this collection circumscribed with the same like a cyst. So this is the suprarenal hemorrhage. Now we have this important slide to highlight the ultrasound markers in gut injury classified in triads. So you have 3 markers related to air, 3 markers related to the wall itself, 3 markers related to fluids to make it easy for you to memorize these triads: air, wall, and fluid. And we have another extra 3 markers related to applying color Doppler. So 3 by 3 by 2-dimension ultrasound and another 3 by color Doppler. So air-related markers are portal venous gas. It is easy to detect in the liver if it is present. Nematodes intestinalis, which needs some experience to differentiate nematosis from intraluminal gas. And then pneumoperitoneum. Pneumoperitoneum is typically, if it is free air, diagnosed better by X-ray. But if the pneumoperitoneum is not free or minimal air or encysted air, that can be missed by X-ray and can be diagnosed by ultrasound. And then we have 3 wall-related markers. So I'm now going to assess the abdomen with the microconvex probe. The index mark is pointing to the head, and I will start with evaluating the liver. I'm just putting at the mid-clavicular line, just below the costal margin, and I can see the liver. There's a lot of moving artifacts, which is actually air bubbles moving inside the portal veins, and I can see the liver is full of bubbles.
Yeah, I can see.
And I can see some bubbles actually moving inside, keep moving inside. So there is extensive portal venous gas, and there is no other explanation other than significant neck in this case. Yeah, I'm now evaluating the intestine, and I'm dividing the abdomen into 4 compartments.